She is.
Hello, my name's Dr. Gallagher. Today I'm going to show you how to give your own intramuscular vitamin B12 injection. Many people have already shifted to give their own injection because it puts you in charge of giving it, and it also reduces your risk of infection coming to the surgery. But you're going to need a few things to get started. The first thing that you'll need to collect from the surgery is a vitamin B12 self-injection pack like this one. And I'm going to take you through what's in it in a moment. You'll also need to order your vitamin B12 injections, and you'll get 4 of those when you order them on your repeat prescription. And then you'll also need a new thing. You'll need a sharps box in which to put your dirty needle and syringes and the glass vial. And you can also order this on your repeat prescription. So let's look in a bit more detail what's in the B12 injection pack. There's an information leaflet about what's in the pack. There are 4 syringes. There are 4 green needles for drawing up the injection, although sometimes if we're short of those we'll use blue needles. 4 blue needles for giving it into the muscle, some cotton wool, and of course you'll need your vitamin B12 injection and a sharps box. Okay, we're ready to go. We've got our B12 vial. This isn't B12 because it's in short supply, but it's a very similar vial. We've got our syringe with a green needle on it, ready to draw up the B12. We've got a blue needle ready, that's the one that we're going to inject with. Some cotton wool if we need it, and our sharps box is to hand. I'm going to take the top of the vial. This is normally quite straightforward. What we'll do is use a piece of tissue paper or some kitchen roll. This is a kitchen roll. Grab it by the bottom of the vial, and then also grab with the other hand and the tissue the top of the vial and break it away from you like that. This one's a particularly difficult one because it's a large vial, but B12 is very easy. We're going to draw up all of the contents of the vial. There's a bit of air left in the syringe, and I'm just going to squeeze that out. Then we're going to take the sharp box, and we're going to put the needle in by putting it underneath the rim and pulling it away. Then we're ready to put the blue needle on the injection, and we're ready to go. There are 2 sites where you can give the injection. The first is in the thigh, which is where I'm going to put my injection, but you can also put it in this big muscle, but we're going to use the thigh. First, make sure that the injection site is clean. Then we take the needle and place it about a centimetre is usually enough. Draw back on the plunger just to make sure you're not in a vein, which we're not. And then put it in the B12 injection. When we pull it out, if there's a bit of bleeding, just press on it for 30 seconds and that should be enough. It's also important to dispose of the needle and syringe properly. We're going to get rid of the blue needle into the box, and the syringe goes in the other side, like that. A bit more pressure, and if you need to put a plaster on it, do that. So you can see a very simple and safe way of giving your own B12 injection. If you have any problems, contact us on Ask My GP and someone will come back to you. Thank you very much.